Okay. We just met with Dr. Lou for my pre-op appointment, and it was amazing. She was really great. I'm so nervous to record in front of you.
So do you want to wait?
No, it's okay. I don't know. Okay. It was really great. She answered all of my questions. She calmed my nerves about a lot of things that I was stressed about. She's mindful of all my comorbidities and actually recommended that I go to the hospital in advance to like meet everyone and give them all the information about like EDS and POTS and stuff, which is like amazing. And it's really happening in less than a month. So, feeling good. Okay. I just spent about over an hour on the phone with the hospital where I'll be having my surgery. We scheduled my pre-admission testing for next week. It was just really overwhelming. We had to go over every condition I have, every medication, every allergy, everything. And, you know, I can't count the number of times the person on the phone has said to me, or people in the past have said to me too, like, wow, I never heard of that. Oh, wow, I'm learning. You're teaching me. I've never heard of that. And, oh, I'm running out of room on my form here. I can't even put any more conditions here. Like, you know, it's hard to hear that. But she was very kind. She was like, you're too young to be sick, and like, I'm sorry you're going through this. She also was like, you're so young, like, to be having surgery. You don't have like a health proxy and like those kind of documents, right? And I was like, nope, I do. She couldn't believe that I had that. So I'm just sort of used to being told that I'm different and too young for things, and it's like I would love to just be my age and dealing with my age type things. It's weird. I'm feeling like, I don't want to say good, but I'm feeling like resolved about going into surgery. Like, I've been feeling at peace with this decision and feeling good about my doctor and what we're doing. And I'm still just having these waves of anxiety, waves of panic, waves of fear, overwhelm. Today and yesterday have been really hard. I went to my cardiologist the other day for medical clearance for POTS, and the appointment was fine. He didn't know much about POTS, it seemed, but he, you know, looked at all of my heart study tests and stuff, and he was like, you're good. And then I got like the notification of the appointment notes, and it said I'm in the lowest class for risk, which is good. But that still carries a 3.9% risk of a cardiac event or death within 30 days of surgery, and I don't like that number. My OCD loves that number. It's sort of flipping the inverse and saying it's actually a 96% chance. So that's fun. So I just feel like I'm like saying goodbye to my life, which is so dramatic, but yeah, just sort of oscillating between feeling good, feeling peaceful, feeling stressed, overwhelmed, want to cry, want to throw up, want to die. Just trying to put everything together, make a shopping list of like, I just ordered all the medications I'll need, like following surgery, like Advil, Tylenol, Gas-X, Miralax for before surgery. I have Colis, I'm ordering magnesium, and then just like foods. Trying to stock up on things, and also my parents will be staying with us, so I'm trying to stock up on foods that they'll eat, and like our fridge isn't big enough, and I'm just like, I feel like this should be simple, but it's just not. So it's Friday night right now, and next Tuesday morning I'm getting lab work for my surgeon of just like testing my blood and everything, making sure everything's good. And then Thursday morning, we'll be going to the hospital to meet the team, get more labs, and hand them all of my medical information and just pray that they will be mindful of all my complicated conditions and things that the team has never heard of. It's very scary. I know it'll be fine, but you know, there's a chance that it won't, so it feels very scary. That's my update. Oh, fun update. Sunday is my little surgery shower with some girlfriends, and I'm so excited for that. We're gonna have I'm gonna make it like a tea party with like treats and have Wicked playing and just be silly and do girl stuff. So I'm looking forward to that, to just like, I was gonna say to get my mind off things, but it's because of my surgery, but just to like have fun. So yeah, I'm looking forward to that. Hi. Okay. So, just getting back from my pre-op appointment and testing, and I figured I'd tell you about it while I get logged in for work. My brain can't do two things at once, so maybe this isn't the best idea, but without sounding too dramatic, I think that was like the best appointment of my life. It was completely unexpected. I didn't know exactly what it was going to be like. I thought I was going to go and get, a blood test to make sure like my blood levels are good for anesthesia. I don't know what they look for, but that, and maybe I would meet the anesthesiologist, and I'd meet a nurse, and I'd meet the team, and they'd go over like, hey, don't do this before surgery and take this thing before surgery, and I don't know. But it wasn't that at all. It was really amazing to be able to go drive to the hospital, see where we're going to be, see where we're going to park, know where the door is, just like stuff like that the morning of, I know I'm going to be so frazzled that to not be somewhere completely new is a big relief. And everyone I met there was so nice, had calm energy, looked me in the eye. Like, this sounds like obvious things, but like it's not always the case. So I just felt really good energy there. And they did do one blood test for my blood type, but I did have lab work on Tuesday for like pre-op stuff, so they're like, we don't have to take a bunch of vials today, which was nice. So they did that, and then I'm waiting in the exam room, and this woman walks in, and she was like, hey, I'm Jen, I'm the nurse practitioner. And she had like a file with her, and she was like, you have a lot going on. And I was like, yeah. And she was like, it's gotta be really hard. And I was like, yeah. And I'm gonna get emotional because I genuinely feel like this was an answer to prayer. Like, it feels today like all the stars have aligned with all the craziness of the last 1 year, 2 years, 3 years, 15 years, my whole life really, to this moment with this person in this place at this time. Like, it was just extremely validating. This person, she said she read my file and all the things that I sent over to them, and she was like, she knows POTS, she knows EDS, she knows endo, she knows patients like me. She's worked with patients like me for years and years and years. And she just validated my whole experience. Let me lock in here. She validated all of my conditions. She talked to me like a real fucking person. She didn't talk like a textbook doctor robot. She looked at me and talked to me like a person in the context of my health. And outside of my EDS physical therapist, that's never happened in my life. And working with my EDS PT has also changed my life. So this was a little bit different, because this is like, well, she's a nurse practitioner, but I was gonna say like a medical doctor in a hospital helping me to undergo surgery, saying like, yeah, you have a lot of conditions. They're all real. They're all serious. They're all disabling. And, you know, cases like yours need special care and attention. And I feel like that has been what I've been trying to say this whole fucking time. And everyone's been like, Michelle, chill. Like, they know what they're doing. Like, it's not that serious. Okay, you have posture. Okay, whatever. Yeah, like, I've heard of it, you know? Like, literally, they've said to me, oh, I've heard of it. It's like, it's not their fault for not knowing and understanding something they don't know. But then it's the treatment that comes after that that harms, because it's really a lack of treatment and a lack of support. And this nurse practitioner validated that, and she was like, doctors, she was like, this isn't personal, but she was like, the truth is, sorry, hold on. Okay. She was like, the truth is, doctors hate patients like you because you're complicated. Doctors have doctor brain, and they like to know the issue, know how to treat it, have a treatment plan. Easy. That's what they're designed and taught to do. But when you have a case like mine or any other chronically ill person with comorbid conditions that don't have cures and don't have a lot of research, doctors don't know what to do with you because you don't fit into their box of how they operate. So you get passed around and you get dismissed and belittled and mistreated, to be frank. And this person really got it. Sorry. And she was like, yeah. She was like, I bet you haven't been believed. I bet, like, this has been really hard to even get these diagnoses. And she had really nice things to say of like, the fact that you're so young and have all these diagnoses at this point is like a testament to you advocating for yourself. And that was really nice to hear, because I don't often think of it that way. I don't think of myself that way because I'm constantly anxious and constantly doubting myself and like, but through all that, I guess she's right in the fact that I have been persevering. And my partner tells me that all the time of how I persevere, and like I've still been trying to find new doctors and asking more people and trying to find the answers and looking for the treatments. And I guess I can certainly say, like with the surgery, I have been advocating for myself, because this is the 4th surgeon that I met with that I'm choosing to go with. And a lot of people in my life, including doctors, were like, just go with the first one. What's wrong with you? Why are you making this so hard? And that was wearing on me, because it's like, I didn't feel comfortable. I'm the one living with these conditions. I know how fucking hard they are. I know how complicated they are. I know how much most doctors don't know about them, and there's all these risks that come with them. So I'm not just gonna have a regular schmegular doctor, not expert, do the surgery on me. Like, no. And so she validated that without me having to say anything. And she was like, the doctor you've chosen is the best doctor you could have chosen. She pretty much only works on complex cases, and you're in the best hands. And she even said like this hospital is sort of an anomaly because it's a small suburban hospital, but for some reason like the best doctors go there because it's like close to the city and like has a better work-life balance, but it's just like better than the hustle and bustle and stress of the city, which is part of the reason I chose it. And she said that, so she used to work at Columbia in New York City, where a lot of great POTS doctors are, and doctors who get EDS, and she like wrote down some names for me to go get a new POTS doctor, which Lord knows I've been trying to find for like 2 years. And she said a lot of them come to this hospital, and that's where she worked. And like basically she assured me that like my team, my surgical team, will understand me and are in the best position to take care of me. And that's what I was gonna say wanted, but what I've needed. And I just feel this sense of like relief washing over me, because for so long I felt like it's on me to educate my doctors and like prevent bad things from happening because I'm the one who has the information and they don't. And now it's like I can just trust them to do their job, which is how it's supposed to be. But like that normally doesn't apply to people like me. So it does feel too good to be true. She also said she's gonna like hand pick my anesthesiologist because she knows which ones like will understand my conditions the most. And I just feel really, really lucky and really thankful. And I can't believe it, honestly. It was like she just walked in there and said everything I needed to hear for the last several years. And hearing it 4 to 5 days before my surgery is like a balm to my soul. Balm, not bomb. Yeah, what else? She also said redheads. So I have red undertone hair. Sometimes it's hard to tell, but like I was born with orange hair. And she was like, it does like mean you metabolize anesthesia quicker, but like tell your team and they'll know that. And she was like, but look it up. Redheads are like, they have special powers. They're mystical. So I thought that was cute. So I'm gonna look into that, like medically, not just like figuratively, like scientifically, like their bodies are different. Also, so we were talking about endo, we talked about EDS a lot, colon stuff. She was like, there's a bug on my wall. She was like, she recommended a colorectal surgeon who gets EDS, and she was like, you're gonna wanna talk to them because you might, she was like, I saw your images and your colon is fucked up. Which, thank you, because I've talked about this on the channel before. My colon is fucked up. I feel it. I see it with my eyes. And why is it that several doctors are looking at it and telling me it's normal, it's not normal? So to hear that from her, without me having to ask, without me having to say anything, thank you. I knew I wasn't crazy. Like, I knew I wasn't crazy. These doctors just don't know, so they don't want to say they don't know. And so I was like, should I hold off and get all the surgery at once? Because she was like, you don't want to have a whole bunch of surgeries. But I think I'm just going to move forward with this. And she said if you were to have a major colorectal surgery, she would recommend that I have that after having kids. And I don't know if I'm going to be having kids, but for now it's like I'm just going to hold off, period. Let's focus on endo. Let's figure out how much of my gastro symptoms are coming from endo and how much is left over that we could be like, oh, okay, that's probably EDS and POTS related. And also I was like, you know, because she was like, there's no treatments really for what you have. And I was like, I know. But I was like, I really just want answers. Like with this surgery, I want to know if there's endo because there's a chance they're going to go in and they don't find it. And she literally laughed at me and she goes, it's there. This woman took one look at my phone and was like, bitch, it's there. So I really just need to like start believing myself more. But I think the surgery will help me do that. And that appointment is majorly helping me do that. And she also talked about disability a lot, and she was like, I don't mean this in a negative way, but she was like, you are disabled. And afterwards, my partner was like, I kind of didn't like the way she was talking about that, which I get, but for me, I was like, thank you for fucking telling me that, because these conditions are disabling. She was like, there are people who are considered disabled, like externally, dealing with way less than you are. And she was like, just because you look like a healthy person who's walking and talking and working, like, you are disabled and you're using all of your energy to do the things you need to do. And she was like, how are you after all that? And I was like, catatonic. She was like, yeah. She was like, accept that you're not able to do things the way other people are, and like, allow yourself to not, she said, let go of perfection. She was looking at me, she was like, I know you already. Let go of perfection and give yourself accommodation. She was like, it's okay to use paper plates. It's okay to get groceries delivered. It's okay to not have 2 events in one day. Like, and like, I know that. And it's easy for me to say that for other people, but it's hard to accept for yourself. And I think having, you know, and I have the amazing community online that's so validating, but to hear it from like a medical professional looking at your chart, looking in your eyes and telling this to you directly, love you. It means a lot, and it's honestly life-changing. So I'm feeling really good. I'm feeling really comfortable. She did make a comment. She was like, yeah, cases like yours, you know, things tend to go more awry, so you're probably the first case of the day. And then she was like, oh, no, I mean, just like, you know, they want to be more, you know, cautious. So there is a risk. There's a genuine risk, and I knew that already. So it didn't wig me out that she said that, because I feel more comfortable knowing these people know how to handle it. And they're going to be looking, they're going to be watching for the things. So let's do this.